Most women diagnosed with early stage 1 and 2 breast cancer and receive treatment can expect a favorable outcome with 5-year survival rates of 80% to 90%. Several local women have received the required treatment to beat this killer disease and are now living their lives cancer-free. In October, during Breast Cancer Awareness Month, some of these women used this opportunity to help raise awareness and to let others know that there is hope, a chance for them to beat this form of cancer. Here's Marlene Jor, a distinguished Guyanese pianist and music teacher.
Since last October, when I last spoke with the public, I finished all my radiation and the chemo. I had to do some extra chemo. And that is finished in January, February. Since then, I've done tests for them to see what's happening with the cancer. The first set of tests that I did with true ultrasound revealed that there was no cancer going to the other organs of my body.
Ms. Jor explained that subsequently she went to visit her daughter, who is a doctor in Jamaica, where a CT scan was done.
And the results have been very exciting for me and promising because all the results show that all my organs are intact and I don't have the cancer at the moment. So I can say that I am happily survived that. But I still have to do further, keep visiting the oncology department of the Georgetown Public Hospital to do tests to see what's happening or what is developing. But since then, I've been able to finish all those tests and I'm now just relaxing and enjoying life once again.
While the causes of breast cancer remain largely unknown, risk factors include age, family history of breast cancer, obesity, and alcohol consumption, among other things. But one thing's for sure globally, early diagnosis of this disease, coupled with treatment, definitively saves lives. Another cancer survivor, Rosaline Clark, a devout Christian and educator, stated that she was diagnosed with breast cancer in November 2016 and decided to have a mastectomy in order to save her life.
I took off my left side breast, and for the past, actually it's 2 years now, I've been blessed.
Ms. Clark says that now, due to early detection of breast cancer and receiving the necessary treatment to combat this disease, she can now live her life to the fullest.
My life has been good to me. As you can see, I'm here with the kids from the Open Bible Daycare, Playgroup and Nursery School, and these kids are my inspiration. Apart from my family and my church members, these kids are my inspiration. Because coming to work every day and interacting with them, it gives me a lift, a joy to be with them. And I'm so pleased and blessed to know that I have all these kids around me to inspire me to greater health. So with that, I am more stronger than before.
According to PAHO WHO, when breast cancer is detected early in an environment where adequate diagnosis and treatment are available, there is a good chance that breast cancer can be cured. If detected late, however, curative treatment is often no longer an option. In such cases, palliative care to relieve the suffering of patients and their families is needed. However, for Nicola Schultz, she was one of the lucky persons who did screening early and is now living a cancer-free life.
In January of 2017, I visited my doctor. He said I was 95% clear of cancer. And I went back in January of this year. And I can safely say that I'm a cancer survivor because I'm cleared of cancer.
In the Americas, cancer is the second leading cause of death, with breast cancer identified as the most common cancer in women worldwide, both in the developed and developing countries. The majority of deaths occur in low and middle income countries, where most women with breast cancer are diagnosed in the late stages due mainly to lack of awareness and early detection and poor provision of health services. Reporting for HGP Nightly News, I am Kristen Macklingam.